Hi guys, welcome to Messenger. This is Dr. Taj. In the last video, we have seen how to deal with your last 7 days of your preparation for the NEET Pg examination. And in today's video, we are going to discuss how to deal with the exam day, which is not less than a war day for the medicos, just like us. Okay, before discussing the examination day, I want to tell a few things which is not there on the slide. Key, a lot of students study before the exam, before the exam, just like a night before the exam also. Okay, now they'll not take a nap, they'll not take a a pleasant sleep, and they'll continue to study for about 2 o'clock or the 3 o'clock in the night. Okay, and they'll take a sleep for about only 3 to 4 hours. Okay, again they'll get up, again they'll study. So what I mean to say is that means the students will study to a lot of people. Okay, the students will also study, a lot of people study 2 hours before the exam also. That's a very wrong thing, because let me explain you how. For example, a student studies for about 10 to 15 hours or more than 10 hours before the exam also without taking any rest. Okay, that's a good thing. Because of that, he got some extra 2 MCQs. Okay, 2 MCQs he is able to answer. That's a very good thing. Then what's the wrong in this test? See, what happens over here is, when you are taking a pressure before the exam, not giving any rest to your brain, okay, now the brain goes into the fatigue. So because of that, what happens, you will be unable to concentrate on the MCQs. Okay, now the concepts where you are very commandable, then you will come into the bit confusion. Okay, now, and you will be unable to get some good concentration in the examination hall. Okay, and you will be frustrated, you will get irritated. So instead of getting that 10 MCQs in a good way, I mean, the student will answer that 2 MCQs in a very good manner, but he'll also lose that 10 MCQs also because of his loss of concentration. So I want, this is my special request to all you people, get a sound sleep before the exam. So means you should go to the bed at around 10 o'clock and get up around 7 to 8 o'clock. Minimum 7 to 8 hours of the good sleep will give your brain a good rest. Okay, so let's go into the video. So today we are going to discuss what to do on the examination day. Okay, so let's start. First thing, that is your hall ticket, okay, or the admit card. Hall ticket or the admit card plus your Aadhaar card or any ID card. Okay, na? Whichever it is, you should keep these 2 things in front of your table. Okay, na? In your visibility. You should never forget this thing. Okay, and next important thing is, try to divert the thoughts. Okay, na? Try to divert your mind from the exam thoughts. A lot of people come into the anxiety. Oh God, tomorrow is exam. Tomorrow is exam. So the people will be having a lot of anxiety. Some people will get palpitations also. Okay, na? Palpitations, sweating in the palms and the soles. Okay, na? And some tingling sensations in the palms and the soles. All these anxiety symptoms will come. So my best suggestion is to divert your thoughts. Okay, na? Divert your mind from the exam thoughts. Don't think tomorrow there is an exam or something. How can you divert? Again, by saying some funny things, talking some funny things with your friends. Okay, now going out for about half an hour, 1 hour in your street, playing with the children, talking jovially with your friends. I mean, with your parents or the small guys who are around you. Okay, now try to lessen your anxiety. Try to decrease your anxiety. And you should think that tomorrow I'm not writing any entrance examination. You should think that I'm just writing a mock exam. Okay, okay, na? Why? Because we'll write the mock exam in a very normal and cool manner. Yeah, nothing is going to happen. I should go and just attend some 200 MCQs. I should keep something. Okay, I should keep something. Nothing is going to come. I'll come nicely. That's it. You should feel the same while going to the main exam also, so that it will reduce the anxiety also. It will also reduce the anxiety. And next important thing is, a lot of people doesn't know, our exam centers will be generally in the metropolitan cities. Okay, na? Exam centers will be something for about something like 10 to 15 kilometers away from your destination. Okay, now that time you have to go through the traffic. So you should start early. You should start early, 2 hours or 3 hours before your examination time. And one more thing, you should prefer a 4-wheeler only, not the 2-wheeler, because if you go on the 2-wheeler, what happens, there will be a lot of carbon dioxide, there will be a lot of sweat, there will be a lot of dust. Okay, now obviously again you will go into the fatigue. Okay, na? And don't forget to take a Dolo tablet or the PCM tablet with you, because a lot of people has a tendency to get the headache if they will be in the traffic for about half an hour to 1 hour. If it happens, again your exam will be gone. So it's better prophylactically take one PCM tablet. Okay, na? Not with your pocket, not within your pocket. You should take it. Okay, na? You should take one PCM tablet and you should go for the examinations. Okay, na? And some students will also have the anxiety and they will be having IBS. What is IBS? Irritable bowel syndrome. Okay, na? They have to go for the washroom in between the examinations. Again, you will get a lot of anxiety and unable to concentrate on the exam. Okay, so all these things will be happening. So for that patients, for that students, you have to take one antimotility drug, that is lopamide 2 mg tablet. Prophylactically you can take it. Nothing is nothing wrong in that. And some patient will also have what you call epigastric pain or the burning sensation because of the anxiety, and you should take a Pantop tablet for the patients. And some patients also, so not patients, some medicos or some friends or some guys will also have the motion sickness problem. Okay, now if you'll travel in the bike, or if you'll travel on the bike or within the car, they'll be having vomitings. To prevent that, you should take one ondansetron tablet also. Okay, so these are the important things that you should remember on the exam day. Try this; it will definitely show you the good results. Please do follow all these instructions on the examination day. I hope everybody will excel in your entrance examination. And I hope you all go into the in all the whatever the PGs, I mean in all the medical colleges, whichever the PG you will get, and I hope best for you. And thank you guys, and signing off, this is Medicine Jerk.